Um, as you can see, after talking to Sam, it really has been, pretty difficult her in the unique situation that she has, regarding the sexual assaults that have occurred and all of the events that, really led up to the situation that did occur. Due to this pretty sensitive nature of the situation with her job, her family, obviously not wanting to make her family feel, obligated to pick between the military and her, things of that nature. And the fact that the assaults did happen about a month ago, and she does have a new commander now, and he's, not her direct superior anymore. Things are really difficult for her to kind of grasp and handle. Her extremely calculated personality also, obviously doesn't allow for mistakes or scheme on things, going wrong in situations such as that, being out of her control. It really turned everything upside down in her thought process, cognitively. Um, it is apparently apparent in the video that Sam is extremely distraught. She's really uncomfortable talking about the situation, um, even really kind of being at therapy. She's pretty reluctant to open up, so that's something, that I would want to in future sessions kind of work on, um, to make sure that she feels that I am the type of therapist that she could work with and, empathizing with her, um, so that she can open up. She is a bit agitated at the beginning of her session due to the frustration, asking her to dive forward, dive farther into the whole situation and really kind of clarify the assault timeline so that I knew, what exactly had occurred and how the whole situation had kind of played out. I did attempt to keep the session flowing in a really normal manner, while really still having like a structured session. Um, the agenda that we set for this session was really to focus on her own personal feelings of the entire situation regarding the assaults. Um, when she did explain that she felt that it was her fault, I felt it was really important for me to give her that example, of the car accident that I did give her through, while we were talking. After working through this, I felt it was appropriate to give her homework for the following week, just as a lot of times in CBT they do, um, to work on things she does have control of, that she's accomplished in the military due to the calculated personality that she really does have. And I want her to see that for her own, you know, career and accomplishment and things of that nature, that it is a good thing to have that type of calculated personality, but that you also have to, and that it does, create accomplishments, but that you also have to be flexible in your schemas and thought processes. Um, I wanted her to also see, making decisions that in an informed, prudent manner, it's okay, um, but that not everything's gonna, work out 100% because that's not life. Um, I also felt it'd be really helpful for her to work on the idea that, on her, idea of self-esteem. She has gotten awards. She's climbed the ladder, been promoted multiple times. She really works well with her superiors. Her superiors feel that she's reliable enough to work with as well, um, which she's been a very valuable asset. Um, it just would give her some few reminders of, some self-esteem boosters, show her how worthy she actually is. And I hope, my other hope for this is that the specific incidents don't define her as a woman or a soldier or a daughter. And I want her to see that this specific incident is not her entire life, and that there's much more to her than that. I felt that it was really important and beneficial to use cognitive theory, and especially cognitive behavioral therapy, in order to kind of restructure her thoughts and beliefs regarding the situation. She doesn't have an extremely, unusual past or any previous traumatic situations or anything of that nature, that would require more psychoanalytic theory or anything like that. So I think that it would have, because there was nothing besides this specific incident that could have triggered, situations, I felt that using something that focused on, the current situational issues that a person can think and modify through their beliefs on a situation will work best for a person such as Sam, especially knowing how calculated she is. I felt it was also important to use this because the military does use this type of therapy for PTSD patients, whether it's assault or trauma in the field or, traumatic brain injuries downrange. They use it a lot, so I think that she would maybe be more familiar with that type of therapy, whether she has friends who use it or things of that nature. And also for continuity, if she ever goes back to see a therapist again and she needs therapy, she kind of would understand the way that structures would work. I thought it was also important to work with the CBT and the ABC model because it shows really how inaccurate her beliefs in reality are and how, unfortunately abnormal, the thought of it's her fault is. The irrational beliefs due to the conclusion that she should have been better prepared or that she should have stood up for herself. She's already ingrained this into her own schemas, so this has made it really difficult for her, so I thought that this would be a great type of model that she can logically think through and say, this is irrational. Because she is a strong woman. She has been a strong woman up until this point, so getting her to kind of get back to that and, re-assimilate her schema is very important. Due to the unique situation and my role is only working with one for one session, I really wanted to continue to use my active listening skills, nonverbal communication, eye contact, clarifying responses, things of that nature. In the video, though, regarding Sam the Army soldier, I did have the most difficult time transitioning between talking about naming the problems that have been occurring and then working, transitioning into the ABC model. I'm also not sure how well I did regarding countertransference. Because I am a military spouse, I have a little bit of a difficult time being objective and not using my own feelings regarding this situation to cloud my social work skills. I feel that I did attempt to stay objective, but I do recall sort of bashing the commander a bit. When she was talking about the assault, mostly because I'd be horrified if any of our military friends or family had to go through such a situation as that, and I feel very strongly about females in the military, and I feel that, they're a great asset, so that would make it, really it makes it a little bit more difficult for me. I felt I did use great active listening skills. Maybe I could have done a better job, though, with clarifying and connecting things up, that she said with her own emotions to reality and kind of make some better connections. I think I did pretty well in clarifying what she had talked about, but connecting I needed to possibly do a bit more. It may have, allowed me to be a bit better regarding the structure of CBT and the focus of therapy. Since though CBT also is a combination of cognitive and behavioral therapy, there was a lot of ground to cover, so I felt that in the really short span of the session, I was really kind of unable to get as many things covered as I would have wanted to, obviously in a full 1 hour session or that. I feel that I really did use CBT well, but I could have incorporated a few more techniques, such as modeling and role-playing, which I'd want to use in future sessions if I continued to work with Sam. Well, thanks in advance for your feedback, and I look forward to hearing some constructive criticism. All right, thank you.